Good morning. On today's Healthier You, we're going to discuss a little bit about the benefits of fiber. Yes, even in a low-carb diet, fiber is necessary. I do know that a lot of people who follow a carnivore diet will tell you that fiber is not necessary, but you will find for many of those folks, what they need to do is they need to substitute with a lot of electrolytes. And one of those is magnesium so they don't get constipated. So, take it with a grain of salt, okay? All right, let's get started with the medical disclaimer. Always check with your physician before starting any exercise or dietary program. Information here is my own personal research and is not into different health topics and is not to be considered medical advice. All right. There are a lot of benefits to eating fiber that should convince you that you should eat enough of it. Fiber likely isn't the first item you look for when you're looking at a food nutrition label. However, your eyes search mostly for added sugars or total carbohydrates, especially if you're trying to watch your blood glucose levels. Or maybe you're looking at the protein content if you're trying to help your muscles recover after a hard workout or illness even. And while food's fiber content doesn't need to be the first thing you look at, you're not doing yourself any favors by ignoring it. In fact, for many of you, if you're following a low-carb diet, even keto, will tell you that if the dietary fibers cancel out some of the carbohydrates. In other words, if you have 10 carbohydrates, dietary fibers are 6, that only counts for 4 carbohydrates. There are many ways to do low-carb diets. That's one of them. One of the other ways is make sure you're not getting any more than 20 a day, 20 to 30 a day. You name it, there's a ton of ways to do that. However, you do need to understand that dietary fiber is essential for our body, for many of the needs that we need. So there's a reason most adults do not come anywhere close to consuming enough fiber per day. And there are some results of not consuming enough fiber. We'll talk about those in a little bit. Only about 5% of men and 9% of women meet the daily fiber recommendation, according to the National Academy of Medicine. This comes from Amanda Beaver, a wellness dietitian at Houston Methodist. That is a serious shortcoming, she says, since fiber benefits your body health in many ways. How does and what does fiber do for the body? I think most people associate fiber solely with how it helps your gut or prevents constipation. It does play an important role in your GI health, but also there are many benefits that extend beyond that even. Number one, it fosters a diverse, happy gut microbiome. Fiber isn't ingested in our stomach like other foods. Instead, it passes through into our colon, where it becomes food for the beneficial bacteria in our gut. So getting plenty of fiber, as well as a variety of types of it, means you're passing along plenty of food for those good, healthy gut bacteria to thrive on. It does promote regular bowel movements. Let's be honest. You probably don't seriously consider those till something is wrong, like frequent diarrhea, not going enough, constipation. There are a few different types of fiber that will help with both of those uncomfortable issues, and that is including soluble, insoluble, and viscous fiber. Each plays a role in helping you have regular and healthy stools. Whole grains in particular are good for this since they contain a lot of insoluble fiber, which is the type of fiber that helps bulk up your stool while still keeping it soft, keeping you feeling fuller longer. Fiber takes longer to digest than other nutrients, so it has that amazing filling power. Huge benefit of incorporating fiber into meals and snacks is how it helps you feel full between them. While this may not directly lead to weight loss, it can help reduce overeating tendencies. Helps to lower your blood pressure, high blood pressure. Studies show that eating enough fiber can help improve blood pressure in those whose levels are high. So it can also help reduce the risk of heart disease and stroke. So cardiovascular benefits of fiber shouldn't be overlooked. Balances cholesterol levels. One particular type of fiber, viscous fiber, has a binding quality to it that can help trap excess bile and cholesterol in our GI tract, which our body then eliminates when we go to the bathroom. This unique property can help maintain optimal cholesterol levels, benefiting your heart health. Some forms of soluble fiber are also helpful in lowering the LDL cholesterol levels. Those are nicknamed the lousy cholesterol, the type of cholesterol that can collect in blood vessels and lead to atherosclerosis, which is hardening and narrowing of the arteries, which affects your blood flow. For instance, oat milk contains beta-glucan, a type of soluble fiber that is also really good for lowering LDL. It also helps prevent blood sugar spikes. Soluble fiber can also help regulate blood sugar levels. Consuming soluble fiber with the rest of your meal slows down the rate at which glucose is absorbed into the bloodstream, helps to prevent blood sugar spikes. This improved control over blood sugar can help reduce the risk of developing type 2 diabetes, but if you already have type 2 diabetes, it can also help with that. It is also associated with lower risk of several diseases, such as heart disease, type 2 diabetes, colorectal cancer. So heart disease is the #1 killer of Americans, so the cardiovascular benefits are probably the most important. Additionally, 1 to 10 Americans has type 2 diabetes, and colorectal cancer rates are on the rise. And it's probably because we're not getting the right amount of fiber, right types of fiber. So how much should you eat a day? The National Academy of Medicine recommends getting, for women 50 years of age and younger, 25 grams. Women 51 years of age and older, 21 grams. Men 50 years of age and younger, 38. Men 51 and older, 30. There's no guideline for grams of fiber per meal, but you would recommend having a fiber-rich food with every meal. Can you get too much fiber? Yes. Getting too much fiber can irritate the GI tract, causing bloating, cramping, diarrhea, and constipation. Isn't that interesting? Fiber tends to pull water into our GI tract. So believe it or not, consuming a lot of fiber, especially if you're not drinking enough water, can lead to dehydration and an increased chance of constipation. So if you're eating processed food, this may mean giving the nutrition label a glance. Concentrated amounts of fiber can be hiding in foods without you even realizing it, leading to unwanted symptoms. Many food manufacturers are adding a lot of fiber to their low-carb or no-sugar products such as protein bars, powders, and shakes, as well as low-carb bread and tortillas. Certain types of fiber, inulin, chicory in particular, can cause bothersome GI side effects like gas, and bloating. For that reason, she recommends limiting protein bars and low-carb foods that contain more than 10 grams of fiber. You'll want to check the ingredients for those lists if you're noticing that you're having symptoms. Fiber is best when it comes how it's packaged by nature. Of course, nature's your best bet. Usually those foods have more moderate amounts of fiber and are better tolerated. Well, what are some of the other benefits? Healthy weight loss. It's well known increasing your dietary fiber intake may help your weight loss journey. So those are some things to think about. Weight control. Fiber-rich foods fill you up faster, keep you satisfied longer. So it will help keep you a little leaner. So while research needs to be performed, there's some evidence that suggests those who eat more fiber tend to be leaner. It lowers type 2 diabetes risk. Does that? The Journal of Diabetes Investigation found that a higher overall intake of dietary fiber was associated with the lower risk of type 2 diabetes. And while some previous studies suggest that insoluble fiber was the best type of fiber for lowering type 2 diabetes, it also suggests the combination of soluble and insoluble fibers predicted greater prevention of type 2 diabetes. It's not really clear why fiber cuts type 2 diabetes risk. They believe it's because it's a combination of fibers' favorable effect on the blood glucose levels, and it also creates a healthier gut and lowering inflammation in the body that can help stave off the development of diabetes. For those of you that have diabetes, it can also help with that blood sugar control. Lower odds of heart disease. That is a big one. You can have increased beneficial gut bacteria because of it. Which, honestly, if you have a lower gut inflammation incident, you're going to have lower systemic inflammation, which can be linked to many chronic health problems. So when you increase your fiber intake, it doesn't take long to see those results. You can start seeing the changes in your gut bacteria within just a few days. Here's the catch though. You have to consistently get enough grams of fiber over time to keep getting the benefits. Skimping on fiber shifts bacteria populations that may have negative consequences and result in increased inflammation in the body. It reduces risk of certain cancers. While the studies are mixed, most seem to point to higher fiber consumption lowering the risk of cancer, especially colorectal and breast cancers. They did find that those people who had higher fiber intake, fibers that are found in whole grains, was correlated with a reduced risk of colorectal cancer. Also, in the study that was done in Cancer Review, found that soluble fiber and fruit fiber has the strongest associations with the reduced risk of breast cancer. So that falls right in line with the American Cancer Society's recommendations to eat foods that are rich in fiber, which include fruits, vegetables, and whole grains. There is some suggestion that it gives you a longer life. When you are including total fibers, which include soluble and insoluble fibers, you have a lower chance of dying early from anything, like cardiovascular disease, cancer. That means even if you were to get heart disease, cancer, or any other condition, consuming enough fiber may protect you from dying from it. More regular bowel movements, that's always a good thing. Find yourself constipated, fiber may help. Fiber makes your poop softer and bulkier, both of which speed its passage from your body. But different types of fiber may provide various levels of success in your quest for more regular bowel movements. Psyllium fiber beats out the other types of fiber for those with chronic idiopathic constipation. If you know what psyllium is, in many low-carb diets, they use psyllium husk that is ground for those kind of things. But when you think of psyllium, think of Metamucil. That's what's recommended when you're having trouble with bowel movements. One of the other things that it does is it creates an all-natural detox. Forget the trendy juice cleanse fads. Fiber naturally scrubs and promotes the elimination of toxins from your GI gut. Soluble fiber soaks up potentially harmful compounds such as excess estrogen and unhealthy fats before they can be absorbed by the body. And because insoluble fiber makes things move along more quickly, it limits the amount of time those chemicals like BPA, mercury, and pesticides stay in your system. The faster they go through you, the less chance they have to cause harm. Strong bones. Did you know that? I didn't. Some types of soluble fiber, known as prebiotics, have been shown to contribute to a higher bioavailability of minerals like calcium in your colon. The increase of bioavailability supports and maintains bone density. Prebiotics provide food for your beneficial gut bacteria and can be found in certain fruits, vegetables, nuts, and whole grains, such as asparagus, bananas, walnuts, onions, legumes, wheat, and oats. Bottom line is fiber, all types, are good for your health. By eating a well-rounded, balanced diet that includes plenty of fruit, vegetables, nuts, seeds, legumes, and whole grains, you will likely get the amount of fiber your body needs to run efficiently and lower your disease risk. And that is it for this session of Healthier You. All right, guys, I'll see you again next week. Everybody have a great week. Bye.